First of all, thank you for coming, and I know it was a short notice for all of you. So my name is Dr. Srinivas Raju Kalagindi. I'm a radiologist. I work for Apollo Radiology International. I'm the CEO and medical director. And we have an education division called ARI Academy, and that's what we're going to talk about today. So I trained as a radiologist in India, first in the Nizam's Institute in Hyderabad. And then I moved to UK and worked there for about 10 years. I came back and have been with Apollo since 2016. So radiology is a specialty that deals with scans, I'm sure most of you know. And because there has been an improvement in technology in the last 10 years or so, the ability to look into the patient's body using scans is now far better than what it used to be 10, 20, 30 years ago. So that means a lot of the diseases are now diagnosed using scanning, imaging, without the need for surgeries and any other invasive procedures. So radiology has become extremely important. Radiologists play a very important role in patient management. So you can see in India now that there are scanning centers everywhere. There are diagnostic centers. Very high-end equipment is being brought into the country, and this is not only in the major cities now. Even the towns and smaller towns also have this imaging equipment. But the doctors that read these scans, that are radiologists, the training that is given to these doctors is still not changed much. So we still do a 3 years post-graduation program, like 1960s and 70s, that has not changed. And also the training quality across the country is very variable. There are some really good training schemes, and there are some not very good schemes as well. So because if the doctors are not good, then the diagnosis may not be good enough, and ultimately patients suffer. So we set out to do a lot of things to improve the situation in India and help the other training centers produce better radiologists. So the first thing we did was look into the foreign qualifications. So a lot of our radiologists, after their MD exam in India, try to get UK or US qualifications. The most common qualification they look for is FRCR exam, which is a UK Royal College exam. So to do that, previously doctors had to wait for several years, sometimes up to 8 years, to get a place in the exam. And then they had to go to London at least 3 times to get the qualifications. It was only affordable to a small number of doctors who had the money and time to do it. So we wanted to change that. So we have made several representations to the Royal College and ultimately managed to get that exam center in India. So that is considered to be one of the major benchmarks in the history of radiology in this country. So now we conduct those exams 2-3 times a year. Several hundreds of radiologists come and take those exams. So once we got the center, we now then wanted to look at how to improve the performance of the radiologist in the exam. Because there used to be a difference in the number of people, the percentage of people passing the exam. Those trained in the UK, the more number of them passed, and Indian pass rate was not that very high. So we started preparation courses. So we run an FRCR 2B preparation course. So I request Dr. Dave Roberts, who has been helping us with this course for several years now, to say a few words about the course.
Thank you very much, Dr. Raju. I'll just introduce myself. My name is Dr. Dave Roberts. I was a consultant in Swansea in South Wales for nearly 30 years and retired 4 to 5 years ago. But more importantly, I was an examiner in the Royal College in London for 6 to 7 years. During that time, I was senior examiner. I've also examined abroad in Singapore and also in the Arab Board of Radiology. So hopefully you can see that my background is very much in the examination field, and together with my good friend here, Professor Ash, who also has been a senior examiner in the Royal College in London, we both felt that The problem with Indian radiology was not the knowledge that the Indian radiologists had, but actually the tips and tricks that we could bring to them to actually improve their performance in the Royal College exam. And I hope over the last 5 years that's exactly what we've done. Dr. Raju has put together a fantastic faculty, and also clearly some of the benefits of the course that we deliver are that we use the same software that is actually used in the Royal College exam. This is the only course in the world that does that. So there are some huge benefits from attending the course in Hyderabad, and ultimately I think our aim was to produce a level playing field for the Indian candidates. And I think the proof of the pudding is in the exam pass rate, which we have improved hugely. I think I'm right in saying that the Indian pass rate was probably of the order of 30 to 40%. Well, we are now up to 60 to 70%, which is the pass rate for the UK candidates. So I feel that along with the faculty, we have delivered a fantastic course in Hyderabad that has made a difference to Indian radiology. And that is down to Dr. Raju's foresight and his delivery of the course, and I can only thank him for that. Thank you very much, Dr. Raju.
So that course is again starting tomorrow, the next course. So we are now the largest course in India and one of the largest in the world. So we've done the course, we've done the exams, and then we wanted to give some help to people who are doing MD and DNB in some of the colleges where the training may not be really adequate. So we started another program. It's called Global Radiology Training Program. It's a 2-year course that the radiologists can do while they are doing their MD and DNB PG course. So this is something that will support their training and hopefully make them on par with the Western trained radiologists. So for that to be delivered, we needed a leader who understands how the curriculum works, because we have mainly using the Royal College of Radiologists curriculum. And then we needed a team of people who are really experienced in teaching. So I'm very glad that Professor Ash Chakraborty here has agreed to come on board as the course director for that course. And he, along with a team of very experienced radiologists from across the world, are bringing the world-class radiology education to the Indian radiologist doorstep. So normally to do that, they will have to go to the US and UK, spend a lot of money, and not everybody can afford it. But now that training is coming to India at a cost that is affordable to everyone. So I request Professor Ash to say a few words about it.
Thank you, Raju, for the kind words. I'll also give a brief introduction of myself. So I'm an Indian, a Bengali who was born in India. I was brought up in India. I did my initial graduation in Kolkata. Then I went over to UK. And over the years, so I'm a pediatric radiologist. So I do the children are my specialty. But I have been also heavily involved with teaching and training. As Raju said, in the Royal College, I have been an examiner, a senior examiner, chair of the exam board. I've also been heavily involved with setting up the Royal College training. I was part of the curriculum committee who wrote the whole curriculum for the Royal College. I was also chair for professional learning and development for the Royal College. So I have got over the last 15 years quite a bit of experience in how to set up radiology training, how to set up exams, how to set standards in order to make sure that the radiologists who come out of the program are of really good quality. And the quality is important because the patients will then get the benefit out of it. I'm also the professor and head of radiology for Oxford University. So I've got that sort of experience as well. So coming back to this program, so I met Dr. Raju while I was in the college, and we exchanged ideas, and we felt both of us have got the common passion of doing something also for India. I've done my bit elsewhere in the world, but I want to also, I've got my heart in India, so I want to give something back to India as well. And part of that program is to see how we can improve training in India. The training in India, as Dr. Raju said, is 3 years, where in Western world it's a minimum of 5 years. What is the most essential part of that training is something we call as core curriculum or core radiology training. And that is the part when a radiologist get training all around in all the specialties, so they can become a good general radiologist. After that, they can do subspecialty training if they want to specialize. But the core radiology training is the foundation of a good radiologist. And in my view, that is the part we need to tackle initially. So for that reason, we are running this 2-year GRTP program, Global Radiology Training Program. So I have used my experience of creating the curriculum in the Royal College, and I've created a bespoke, detailed curriculum for the Indian trainees. I have also managed to get the best of best radiologists all around the world. They are from UK, they are from India, they are from Middle East, they are from America, like Dr. Kalwa here is part of my faculty. So we have got the absolute best people who are teachers, well known internationally, to come and join the faculty, and they are the ones who are going to personally deliver the training. And this training, what we are trying to do is to be not only about the educational content, but also how to talk to patients, how to have clinical governance, all aspects of training we are covering. And what we are hoping that this, along with their DNB or MD program, when they finish it and undertake it, they will become a radiologist who can be compared to the best in the world. And they will have the confidence to go anywhere, join any sort of diagnostic center or a teaching hospital or a university, and they will be respected. But more importantly, they will provide the best care for the country and the people in that country. And doing this in India, we hope that a lot of them will remain in India and provide that care to the Indian population, because they are no different from the population elsewhere in the world. And I'm quite passionate about this, and along with Dr. Raju, we have got set all the sort of organization, and I'm happy to say that we are launching this program on the 1st of December this year. So this program is going to start and it's going to roll on, and I hope that all this will make a difference, not only to the radiology training in this country, but for the welfare of the patients in this country.
Thank you, Ash. So having done that, so we've done the exams, and then we looked at the general training. Then we wanted to do something at a more specialist level. So we need specialist radiologists in this country also. So radiology has now become very specialized. So there are radiologists who are interested in the brain, some interested in the abdomen, some in chest, etc. So that opportunity is not widely available in India. So we wanted to look at that. So to do that, we developed something called a mini fellowship concept. So that is a week-long program or a month-long program with online coaching. So that will focus on one area of the body. So the first program we are doing is happening right now as we speak. It's the abdominal mini fellowship. And we are extremely fortunate to have faculty from Harvard Medical School in the USA to support us with this program. So I've got Professor Mukesh Harsinghani with me, who will give you a bit more information about the course.
Thank you, Dr. Raju. Just by way of introduction, I'm a professor of radiology at Harvard Medical School in the US. And I'm really fortunate to be here as part of this mini fellowship program. Before I kind of talk about the importance of doing that, just wanted to congratulate Dr. Raju and his team on the excellent organizational effort that has been put into making this a success. And I can clearly see the value of radiology residents in training here in this country availing of this wonderful opportunity. So as you all know, I think imaging or radiology is now the stethoscope of the medical industry. You cannot walk into a hospital and get assessed without getting some kind of imaging. And you need to be highly specialized in terms of looking at imaging. Gone are the days when you had a radiologist who could do head to toe. Now you have to be specialized in certain anatomic areas and provide the necessary clinical information that is required from our colleagues for appropriately treating and triaging the patients. And so I think doing this kind of mini fellowship program exposes the radiology residents in training and also established radiologists to the nuances or the subtleties of what goes into the in terms of doing subspecialty or practicing subspecialty radiology. So I think this would be extremely valuable and beneficial to the radiology community at large here. And again, congratulate Dr. Raju in taking the effort and developing this program, and hopefully this kind of grows and the community at large in India benefits from this exposure. Thank you.
Thank you very much, Mukesh. And we move on to the final part of radiology, which is interventional radiology. It is not new, but it is growing topic. So the diagnostic radiology, which is doing a scan and providing a report, is to tell what's wrong with the patient. But interventional radiology will help treating the patient. So interventional radiology basically involves, treating conditions using procedures like drainages and biopsies that are done through the skin, but also doing a lot of vascular procedures like angioplasty, stent placement, etc. And also some of the cancers are now being treated by radiologists. So again, we are fortunate to have Professor Sanjeeva Kalwa, who is the head of interventional radiology in Mass General Hospital in Boston, and another professor at Harvard Medical School. So he will talk about the interventional program that we are about to start.
Thanks, Raju. So I'm Sanjeeva Kalwa. As Raju mentioned, I'm Professor of Radiology at Harvard and the Chief of Interventional Radiology at Mass General Hospital. Interventional radiology is an exciting specialty. We use imaging guidance of CT scan, MRI scans, and fluoroscopy and ultrasound to see inside the body and operate inside the body. So these surgeries are less expensive and sometimes can replace the surgery with better outcomes for the patient. So we need a lot of them in India to treat patients. There are only a few of interventional radiologists in India being trained at big institutions, but many of the small towns do not have enough interventional radiologists to cater to the population. So our aim with this program is to train a lot more interventional radiologists in India through a combination of simulation and outpatient training at multiple institutions to increase the number of people who could serve at small towns and rural areas. And Raj has a great plan about it. I'm very happy to be part of it, and we'll work together to make this a great success.
So thank you very much, Sanjeev. So in summary, what we are trying to do here is to try and do our bit along with these experienced teachers from Oxford, Harvard, etc. So these are all, as you can see, have a passion to teach and improve radiology in India. And we are doing it in the form of multiple courses that are already started, and some are about to start in the near future. So we will now take questions. We can ask questions in Telugu also if you want. In Telugulo చెప్పమంటే ఒక చిన్న brief చెప్తాను. సో రేడియాలజీ అన్నది మెడిసిన్లో ఒక స్పెషాలిటీ, అది మీకు అందరికీ తెలుసున్నది. సో మనం సిటీ, ఎంఆర్ఐ స్కాన్స్ అండ్ ఎక్స్రేస్ ఇవన్నీ చూస్తూ ఉంటారు. సో అవి ఇప్పుడు ఆల్మోస్ట్ అన్ని రకాల వ్యాధులకి డయాగ్నోసిస్ చేయడానికి స్కాన్స్ అనేది అవసరం అవుతుంది. సో ఇండియాలో కూడా మిగతా వెస్ట్రన్ కంట్రీస్ లాగే మంచి ఎక్విప్మెంట్ ఉంది. సిటీ, ఎంఆర్ఐ మోడర్న్ ఎక్విప్మెంట్ తీసుకొస్తున్నారు. బట్ రేడియాలజిస్టులు ఎవరైతే డాక్టర్స్ ఆ స్కాన్స్ చూస్తారో వాళ్ళ ట్రైనింగ్ మనకి వెస్ట్రన్ కంట్రీస్తో ఈక్వల్గా లేదు. మనకి ఆ రకమైన ట్రైనింగ్ ఇంకా రాలేదు. ఒకటి ఏంటంటే మనం 3 సంవత్సరాలే చేస్తాం రేడియాలజీ, మిగతా యూకే, యూఎస్లో 4 ఏళ్ళు, 5 ఏళ్ళు, 6 ఏళ్ళు చేస్తారు. సో టైం తక్కువ. రెండోది టీచింగ్ చేసి డిపార్ట్మెంట్స్ కూడా కొన్ని మంచివి ఉన్నాయి, చాలా మంచి డిపార్ట్మెంట్స్ ఉన్నాయి. బట్ చిన్న డిపార్ట్మెంట్స్లో ఆ రకమైన ట్రైనింగ్ లేదు. సో ఆ ట్రైనింగ్ లేకపోతే ఈ రేడియాలజిస్టులు మంచి డయాగ్నోసిస్ ఇవ్వలేరు. మెషిన్ ఒకటే మంచిది ఉంటే సరిపోదు, డాక్టర్స్ కూడా ట్రైనింగ్ ఉండాలి. సో ఆ డయాగ్నోసిస్ లేకపోతే పేషెంట్ ట్రీట్మెంట్ సఫర్ అవుతుంది. సో దీనికి కావాల్సిన స్పెషలిస్ట్ ట్రైనింగ్ మనకి ఇండియా నుంచి చాలా తక్కువ మంది బయటికి వెళ్ళి డబ్బులు ఖర్చు పెట్టి చేయగలుగుతారు, మిగతా వాళ్ళకి ఆ అవకాశం లేదు. సో మన వాళ్ళు వెళ్ళటం కన్నా ట్రైనింగ్ని ఇండియా తీసుకురావడం అనేది దట్స్ ద కాన్సెప్ట్. మేము దాని మీద పనిచేస్తున్నాం. సో వీళ్ళు అందరూ ఎక్స్పీరియన్స్ డాక్టర్స్ వాళ్ళ టైం యూటిలైజ్ చేసి ఇండియాకి ఏదో ఒకటి మళ్ళీ వెనక్కి ఇవ్వాలి అన్న సిద్ధాంతంతో మనకి సపోర్ట్ చేస్తున్నారు. అందుకని ఈ పెద్ద ఇన్స్టిట్యూట్లో ఆక్స్ఫర్డ్, హార్వర్డ్ అన్నిటి నుంచి వచ్చారు. సో వాళ్ళు మనతో పాటు కలిసి ఇండియన్ రేడియాలజిస్ట్ వాళ్ళు ఎక్కడున్నా సరే డబ్బులతో సంబంధం లేకుండా, ఆర్థిక స్తోమతతో సంబంధం లేకుండా వాళ్ళు ఈ రకమైన ఇంటర్నేషనల్ ట్రైనింగ్ తెచ్చుకొని మంచి డయాగ్నోసిస్ ఇచ్చి పేషెంట్కి బెటర్ ట్రీట్మెంట్ ఇవ్వడం కోసం చేసిన ప్రయత్నం.
Okay. So what is the training program fees structure?
Yeah, I will answer that. So the fees depends on the course. So some of them, 2-year program is right now 12 lakh rupees. 12 lakh rupees for the entire 2 years. And that includes multiple assessments and exams. And British Institute of Radiology is endorsing this program. So వాళ్ళు అల్టిమేట్గా సర్టిఫికేట్ ఇచ్చినప్పుడు మేము ఏఆర్ఐ ఒకటే కాకుండా బ్రిటిష్ ఇన్స్టిట్యూట్ ఆఫ్ రేడియాలజీ కూడా దాని మీద సైన్ చేస్తాం.
I have 2 questions. First for
Hi, I'm Ratna Chotrani. I just wanted to know, in a time where artificial intelligence is being considered as something that will do away with radiologists, how do you think these courses are going to be helpful? I do understand radiologists are important, but when we are talking about technology, getting into all areas, all gamuts of healthcare, how do you see the role of radiologist? And also there are high volumes of data that radiologists handle. So the accuracy part, again the technology is changing every now and then. So how do you perceive that?
Yeah, that's a very important question. I think very pertinent question to the current situation. So technology has been a cornerstone of radiology from the beginning. Now AI is going to not replace radiology, but in fact is going to help radiology become even more important. So there are 2 things that we do as radiologists. One is detecting the abnormality, and the second thing is interpreting it and then coming to a clinical conclusion. So it's the second bit that AI cannot replace. It might help us in identifying the problems easily. In fact, it will reduce the number of mistakes radiologist makes because the detection is done by the machines, and the radiologist can spend more time on forming an opinion. So we do a lot of work on AI. We've been partners with some of the large multinational companies. So we think AI will help radiology rather than replacing. And these courses are therefore important because we are not focusing on just making a diagnosis in these courses. We want radiologists to be confident to come to a clinical level conclusion and then communicate with the other doctors to see how we can help the patient. So that AI cannot do, at least not in the near future.
Just to add to that, I think you can see the evolution of radiology and radiologists over the years. So like one difference say in UK or in England where I work is that I hardly do any scans. So sonographers can do the ultrasounds, CT radiographers do the CT, MR radiographers do the So my main job, if you look at my work, is most of it is interacting with clinicians, is to hear the patient story, the clinical problems, and then interpret the radiology in line with that to give them advice. And as Raju said, that is the main focus going to be. So radiology is not going to be replaced by AI. I think whenever new technology comes, we all feel threatened that something is going to get lost. But I think the trick is to imbibe the new technology and enhance the service you offer. And I think AI will settle down, will have its role. And as Raju said, it will do a lot of the manual work that we spend a lot of time. And we will add more value to the service by interacting with the clinicians and making it different for the patient.
Does anybody have?
So what is it? Continue.
No, I just wanted to also talk to your second point, which is you're absolutely right. When I started my training, we used to have 20 images from the CT scan to look at. Now, on an average, our CT scan contains roughly about 2,600 images. And so you can imagine that there is a lot of data that we have to sniff through. And where AI really helps is in terms of collating that data and providing it to us so that we make the best educated guess. I'll give you a simple example. If I tell you I have a statement that I have a test that can diagnose every single patient with cancer, and it's called the nose test. If you have a nose, you have a cancer. I will be right 100% of the time, right? But I will also be wrong many times because many patients with nose don't have cancer. And that is the value of AI is, it brings in what we call sensitivity, and the radiologist's knowledge helps with the specificity. And the balance is what is needed. It's, as Raju alluded to, or Dr. Raju alluded to, it's going to help us be better radiologists to sniff through the large data and provide the information. It's not going to replace. The person who made the statement 10 years ago, I won't tell you who that person was. When he required his scans to be read, it was read by us at MGH. So you can imagine that it's not going to go. We are not going to go.
Yeah, of course. I mean, I understand that human intervention is very important. Yet, that was your society which, expressed concerns. So I was asking.
Absolutely. Thank you. That was a very useful question.
Thank you. I just wanted to know what is the kind of demand that we have for radiologists, and how do you ensure that the job challenges are met? At the end of it, jobs are important. And also, how do you retain them after, giving them that kind of technology training?
So that's again another important question. So the shortage of radiologists is two types, quantitative and qualitative. And a lot of what we are talking about today is qualitative shortage and how we're going to address that. The quantitative shortage, which is not having enough number of radiologists, clearly that's not something we can easily influence. That depends on the number of departments available to train. But again, I think what AI can do is to reduce the amount of time a radiologist spends on a report. So hopefully that will help people to get through more volumes of cases. But the shortage has to be addressed. It's a global problem, not just in India. It's there in the US and the UK. So we do need more radiologists, and technology can go some way in helping that shortage. Any more questions?
Hello sir, I am Amjad Ali. I would like to know which area of radiology requires highest amount of skill and where chances of error are more. My second question is, in the modern radiology, what are the safety mechanisms for radiologists as well as patient exposing repeatedly to the radiations?
Related to that, when you were talking about the second question, I just want to add to that. In the times of deep, you have this, the threat of, data being stolen. What is that called? Deep intelligence,
Deep fake, you're saying?
Deep,
Yeah.
Sorry. So in times of deep fake, how do you really ensure that the data is, secure? That was really.
There are 2-3 topics here, so I'll ask my colleagues to answer. I think Sanjeeva can probably answer the radiation side of things better, and then maybe Dave, do you want to comment on the errors and what are the areas where the most errors could happen?
I've been out of practice 5 or 6 years, so maybe that's an excuse, but no. Certainly in the UK, you have audit meetings, and your errors are published and discussed in a frank and open manner, and that's how it should be. And clearly, if there are any lessons to be learnt, they are fed back in an organised way to any department. Now, I can't talk about Indian radiology, and I'm sure somebody could comment on that, but certainly that's the way forward. We have clinical governance, which should hopefully we learn from our mistakes, and that's the most important thing. One of the questions was, well, which bit of radiology it makes the most mistakes? I would say every part of radiology. If you don't make mistakes, you're not doing enough work, basically. All right. But clearly, we need to minimise our mistakes, and hence, education is extremely important. and governance is extremely important. And I think that comes back also maybe to to your question about data as well. Every single company, every single institution is worried about data protection, and I think that's a huge issue in today's world. I'll stop there.
I'll just answer that question a little bit more, like what is the current practice and how do we address error and patient harm, not only in radiology but all aspects of medical thing. Now, one thing is true, all of us make mistakes. And if anybody tells you that I don't make any mistakes, he is like, having a drink and not getting drunk. You either don't drink or you are lying. So the problem is that when mistakes are inevitable, how do you reduce it? And more importantly, how do you learn from it? So in UK, what we have got is something called, we have stopped pointing fingers and accusing people. So like every month in my department, we will look at most cases that mistakes have been made, and with an anonymous, threatening way, we'll discuss those mistakes, and then we'll collect the findings and distribute it to all the radiologists that everybody can learn. Now in UK, there is another huge change which has come in. There is a committee called REAL Committee, which is again real understanding and learning from errors and mistakes. And the person who leads that program is one of my friend called Dr. John Smith, who runs it. And I think that it is very important, as you said, as the lady said, that this should be a fabric or part of teaching radiologists and training them to not shy away from the fact that we make mistakes, but to learn from it. So as part of the GRTP 2-year course program, this is one of the elements I want to teach our radiologists here as well, is how to look at your own error rate, how to look at your own mistakes, how to learn from it, and do it in an open manner, not hiding things anymore. So I'm expecting that Dr. Smith will come here to give the talk and talk to the trainees here that will come to the GRTP program, because I think apart from learning and training, learning from mistakes is as important.
So there are two more questions. I think one is about data. So I think as Ash and Dave mentioned, data security, we take it very seriously. There are international regulations like the GDPR in the UK and Europe and HIPAA in the US that we try to comply with. There's one more question about radiation. Do you want to say anything?
Protecting your patient from the maximum radiation is your job.
Yeah, so among different radiological tests, only a few of them are with radiation. MRI has no radiation. Ultrasound has no radiation. So the thing that has radiation is CT scan and X-rays. Compared to previous generation scanners, the current scanners are so sophisticated that the radiation dose is maximally minimized in the current scanners. So it's very well calibrated now so that exposure to other people other than the patient is even more or less now. As an interventional radiologist, we use fluoroscopy or X-ray guidance to do all procedures in the patients. We get exposed to those things as well as we operate on these patients, but we take all precautions for us and for patients to minimize the radiation. A principle called ALARA, where we like to minimize as much as possible, as much as reasonably we can achieve it to provide the care to patients. So the current scanners are much superior compared to old generation. I think the concerns about radiation are much lower now compared to before. They're much safer scanners now. And we have alternative scanners. For example, we don't have to do CT scan for some conditions. We can always do MRI scans, so you totally avoid CT scans.
So this course is open for international colleges as well, apart from India?
Yes.
And if so, how many are actually enrolled here in India?
There's quite a few that come for all our courses, especially from the Middle East and from South Asia. But the global radiology training program, we called it global because we want to take it to developing countries, not just India, across Africa and some of the other developing countries also. So at the moment, for example, the event that's happening next door, I think there is out of 50, 60, about 5 or 6 are from outside India. So we have people coming from outside.
Your intake is 50.
It depends on the course. So the mini fellowship, we do it with smaller numbers because each of the doctor will need their own workstation and access to the cases, etc. So we limit the number of places available For the GRTP, it's unlimited number, so we can take any number of people. So, if there are no other questions, so thank you very much for. So for GRTP, the certification comes from us and also the British Institute of Radiology. They will jointly issue the certificate.
So does it provide an application to the radiologist to practice in any part of the world?
So the FRCR, the exams and courses we do, FRCR is recognized in most of the world. So that is recognized. Some of the smaller courses we do are more of upskilling courses rather than a certification course. Okay, thank you all very much for coming.